Hello, I'm Marvin Hardy, and we are so glad that you're going to be a part of the Grace team. We hope that you have the most wonderful and meaningful time serving here. Grace began very simply around the idea that people in our community, created in the image of God, are being left behind medically, and it just did not sit well with us. In fact, it really broke our hearts. Grace is upside down medicine. If you're low income and uninsured, you qualify. This is your place. It's holistic, it's comprehensive, and our patients can't believe it. They are so grateful. Most low income uninsured do not have a place of ongoing medical care, where their name is known, where their chart is kept, where they can be seen over and over again. Their medical home. At the heart of a medical home is relationships. And here you have the freedom to get to know our patients and learn their stories and walk with them in their journey. All of us have the awesome joy, privilege, and responsibility of helping restore the image of God in everyone we encounter. And as it says in Hebrews 12:15, to see to it that no one misses the grace of God. So thank you for being here, and thank you for being a part of the Grace Medical Home team.
Welcome. My name is Stephanie Garrison. I'm the CEO of Grace Medical Home, and we're thrilled you want to be a part of our team. Grace Medical Home is a comprehensive medical practice for the low-income uninsured in Orange County. What does that mean to be a medical home? Well, it's simply an approach to care, relationship-based care, where the patient's at the center of their medical care, which is precisely what the low-income uninsured struggle to find due to insurance status or cost barriers. We offer so much more than primary care. Really, it goes far beyond that. It includes secondary care, procedures, images, community resources, social services, mental health counseling, medications, x-ray, labs. The list goes on, and we're so excited you want to be a part. So Grace has served more than 4,000 Central Floridian low-income uninsured. These are our friends and neighbors who we work alongside with and don't even know it. People who work in the grocery stores, who work in the communities, in farms that don't have access to regular care. Last year we provided more than 11,000 patient visits, so very high volume. Our hours of operation are Monday through Thursday from 8 a.m. to 6 p.m. We take an hour off for lunch every day from 12 to 1, where we close our practice, and then we're open on Fridays from 8 to 12. We start every day with devotion, which lasts about 10 minutes. So please arrive right on time at 8 o'clock so you can be a part of a wonderful way to start our day. We're able to provide these comprehensive services through a variety of partnerships that are so vital to us, and volunteers and community partners. It's truly humbling to be a part. But one of the neatest partnerships we have is with students, and specifically with the UCF. The College of Medicine sends medical school students here twice a month who serve our patients. We have undergrads, we have social workers, pharmacists. The list goes on and on. It's just really a fabulous place to be. We're actually a patient-centered medical home accredited organization, and less than a dozen free and charitable clinics in the country have earned this recognition through the National Committee of Quality Assurance. So we're excited you want to be a part, and you get to experience what it's like to be at Grace Medical Home, because there's no place I'd rather be.
Hi, I'm Carrie Williamson. I'm the volunteer manager here at Grace, and I get to talk to you about volunteers. We could not do what we do without our amazing volunteers here at Grace. We consider them part of our family, part of the Grace family. We can't do what we do for our patients and how we help our patients every day without amazing volunteers. Our volunteers work in a bunch of different areas. They are providers, they're specialists, they're counselors, they're nurses, they're CNAs and MAs, and non-clinical volunteers, spiritual care volunteers, and devotion leaders, as well as a lot of interns that come through Grace that are seeking to be doctors or PAs or nurse practitioners one day. We also provide opportunities for groups to volunteer. mostly during after hours here at Grace. They can do different things outside or different projects we have going on. Also, volunteers clock in and clock out. We track all of our hours for different grants, and just so that we're able to report the amazing things that people do here. In fact, in 2017, our clinical volunteers, we had over 500 volunteers come through Grace that were clinical volunteers, giving over 5,000 hours. And for non-clinical volunteers, we had over 300 come through Grace, working in non-clinical areas, giving over 15,000 hours. If you want more information about volunteering, or if I can answer any other questions, please check your information packet and come find me. I'd be happy to help. Thank you.
Hi, I'm Dr. Sherry Brooks, the Adult Medical Director for Grace Medical Home. And as others have, I want to welcome you here and thank you again for sharing your gifts with us, because we could not do what we do here without each one of you. Our practice is a little bit different here in that we are, as has already been said, relationship-based. And I consider us a domestic mission, a place where we can have a ministry sharing the love of Christ. We've seen in the past year a bit of a change in demographics, and we're seeing now more non-English speakers. And also we've noticed the severity and complexity of illnesses have increased. We see the usual hyperlipidemia, diabetes, obesity, hypertension, but we're also seeing some zebras, which kind of make it fun to practice medicine. And then finally, we've seen an increase in mental illness. And fortunately, we have a nurse practitioner a psychiatric nurse practitioner that can help us with this. From a primary care perspective, it's been a real blessing to have all of our volunteer specialists, because they can assist us in some of these more difficult cases. And from a specialist perspective, we have strong primary care providers, mid-levels and MDs, so that you should never feel you have to practice outside of your specialty. One of our goals is to prevent emergency room visits, because for many of our patients, the only place they could receive care before coming to Grace was to an emergency room. And so we hope we show value to the community, as well as just giving a medical home to these individuals. Again, I would like to just thank each one of you for your commitment to us, and thank you.
Good afternoon. My name is Jonathan Line, and I manage 2 departments here at Grace Medical Home. The first department I want to talk briefly about is behavioral health care. Behavioral health care encompasses mainly 2 things: mental health counseling. We have over a dozen counselors that are available to see patients here at Grace Medical. The second area is social services. And what we want to do with our patients here is try to help them in the areas of life that are non-medical. Oftentimes, if a person suffers from depression or anxiety, it can get in the way of their continued healing and compliance with what their doctor wants them to do. So we have the counseling services available for them, as well as we also have a psychiatric nurse practitioner who can manage their medication if need be. The other area of behavioral health care, as I mentioned before, is social services. Many patients that come to us are economically challenged, and maybe they have a need for some assistance in paying rent or paying for utilities. Maybe they don't have enough food for their family. Maybe their house is not safe, among a number of other things. At a patient's first appointment, and then subsequently each year beyond that, the patient meets with one of these social service interns to determine where they can find resources to help them in these areas. There's more to the department than that, and I'd be happy to talk with any of you more about that later. Just feel free to give me a call or stop me in the hallway. The other area that I manage is a group called the Grace Ambassadors, and they are our spiritual care team. This is also a service that's available for our patients. If you've ever been in the hospital, you may have seen where hospitals have chaplains. It's similar in a way to that. We have qualified people who volunteer. They spend time in the waiting room just visiting with people. They're available to meet one-on-one for a private appointment if need be. They can help direct people to churches in the patient's neighborhood, depending on what denomination they might want to become affiliated with. They also are able to point the direction for maybe support groups that meet at churches. The Grace Ambassador Spiritual Care Program is not just for Christians either. We have patients from many different backgrounds, both culture and religion, and our folks are there to treat everyone equal and to listen and meet the patient where they are. If you have any more questions about this department or would like to become involved, please see me or give me a call. My extension is 2069. Thank you very much.
Hi, welcome. My name is Susan. I am the Care Coordination Manager. Care Coordination is the department that helps connect patients to services outside of the primary care visit. These are services that the primary care provider deems necessary for continued patient care. Specialty services such as cardiology, orthopedics, and endocrinology are just a few practices that we can link our patients to provide that next step in care. Over 22 specialty services are offered here in-house at Grace Medical Home. For those services that we can't provide in-house with our specialty care, we also have over 40 practices in the community that are able to help us provide this care. In addition, we provide diagnostic imaging services for our patients. This includes mammograms and other diagnostic testing like MRIs and ultrasounds. These are important tools for our providers to be able to diagnose and send our patient on to the next step. Because we work with such a generous community, we often are able to provide these services to our patients at little or no cost. Because our patients don't have insurance, we are the connection for our patients. We are the ones that need to get them to the next step and make sure that they get the services needed to complete their care. Care coordination is yet another link in the whole patient care philosophy here at Grace Medical Home.
Hi, I'm Gloria. I work with the intake department. We're actually the first point of contact for applicants. They either call to inquire if we're accepting new patients or they stop by in person to apply. We do our best to make them feel welcomed and help them understand what is needed in order for them to become patients. Our goal is to obtain the necessary information in order to determine their eligibility. Some of the eligibility requirements are that they must live in Orange County, be under the 200% poverty guidelines, and also be uninsured. We do have an application process, and some of those steps consist of phone pre-qualification, an application that is completed by the patient, and once approved, we schedule a registration appointment to get them established as a patient, at which point they will get their first doctor's appointment scheduled. Since applying to Grace is a multi-step process, our goal is to walk them through the process until they are established and registered fully as a patient at Grace. If we are unable to help the patient and register them as a patient at Grace, we do provide other resources in the community that they can reach out to in order to get the help that they need.
Hi, my name is Shanna Kovacs, the Clinical Nurse Manager here at Grace Medical Home. The main focus of my job is to ensure that the daily functions of the clinic run smoothly and that we have enough clinical providers and nursing volunteers to meet the needs of our patients. If you are watching this video, welcome to our Grace family. Please know that we could not do our job without you. Here at your time at Grace, I will be your resource person on the clinical side. Please come to me for any questions or concerns, or praise reports. We always welcome input. Let's talk a little bit about the scheduling on the clinical side. I do individualized scheduling with all of our volunteers so that the schedule meets your needs and meets the clinic's needs. I do post schedules 2 months in advance, so you're able to sign up as early as 2 months ahead of time. I know that's not possible for everyone, so just get with me and we'll make sure that the schedule meets everyone's needs. We do ask that if you sign up for a shift, please try to make sure that you're here. We have a small staff and we rely heavily on our volunteers to meet the needs of our patients. We do realize that people get sick and emergencies happen. Just please call or text me as soon as you know so I can make sure that the clinic is covered. The other requirement is that for the clinical side that you please volunteer at least 1 shift a week. This is to ensure that you stay abreast of any changes that are happening in the clinic, and also so that you're comfortable with EMDs, which is our electronic medical record used for charting. During your orientation process, you'll be receiving some information from OSHA. This is to help protect you in the workplace. You'll also be receiving some information from HIPAA, and this is to ensure that our patients' privacy is respected. Thirdly, you'll be receiving information on our fire and emergency evacuation plans. Please be proactive in your areas. Pay attention to the emergency numbers that are posted and also where the fire extinguishers are located throughout the building. If there is a code, please know that we call 911 first. Our clinical staff is CPR trained, we have a limited code box, and we do have an AED on site, but 911 will be the first course of action. Thank you for your time and attention, and I look forward to serving our patients with you.
Hi, I'm Dagmar Ruiz. I am responsible here for the labs and the x-rays. Thanks to the partnership that we have with Orlando Health and Florida Hospital, we are able to run labs for our patients, including cholesterol, A1Cs, the comprehensive panel, and so forth. Florida Hospital and Orlando Health alternate weeks when it comes to running our labs for our patients. We also do x-rays. I'm the x-ray tech here, and we're also able to provide ultrasounds for our patients here as well. Florida Hospital is the one that reads our x-rays and ultrasounds. They send reports to us when they read them, and so we have those available for our patients. If you guys have any questions for any of those matters, I am here for you guys. Thank you for being here with us.
Hi, I'm Julia. I'm the pediatric nurse here at Grace Medical Home. Pediatrics makes up about 20 to 25% of our total patient population. It's a lot easier for kids in the state of Florida to qualify for some sort of insurance like Medicaid. So as you're here around the office, you'll see a lot more adult patients than you will kids, and that's the reason why. We will see kids here at the office for a variety of reasons. We'll see them once a year if they're relatively healthy and don't have any health concerns. We'll see them for their yearly physicals, their sports physicals, school physicals, all that stuff. And then we also, on the other end, have a lot of kids that have several complex health issues, and those kids require a lot more close monitoring to make sure that they're getting the quality medical care that they deserve. Those kids we may see anywhere between once or twice a month until they've stabilized and we can, taper them off and see them less frequently. The state of Florida provides vaccines for all of our children that are 18 years and younger. They provide the vaccines for us through the Vaccines for Children program. So the CDC, any vaccine that the CDC recommends, I'm able to vaccinate our kids with here. Everything that's required for school, like your measles, mumps, rubella, and your chicken pox, and then also the ones that are not required for school but still recommended by the CDC, such as your HPV or meningitis. Another aspect of my job is that I'm the staff member that oversees the medication storage room. So last year, total value of donated and meds that came into that room was $3.6 million worth of medications. That includes patient assistance program medications, which is PAP, prescription samples, and over-the-counter samples as well. So PAP, it's a whole big program, stands for Patient Assistance Program. It's a way that pharmaceutical companies can opt in to provide free medication to patients who qualify. Each company has their different qualifications that they require. But for the most part, a patient needs to have no insurance coverage and be low income. So 99.9% of patients that qualify to be GRACE patients qualify for those PAP programs. I think that's about it, short and sweet. So I look forward to seeing you guys around the office. Thank you so much, and I will see you soon. Bye.
Hi, my name is Bonita Anderson Peters. I am a registered nurse and certified diabetes educator. Here at Grace, everyone calls me Bonnie. I am very privileged to be here at Grace. I wear several different hats here. When I first came here, I started volunteering as a diabetes consultant to the doctors and nurse practitioners, which I continue to do diabetes education. In the last few years, we have started several different programs. One was, we've done a diabetes prevention program in 2014 and 15. We then started a Way to Go program, which was an obesity intervention program through a grant from Florida Hospital. And our most recent program is the Diabetes Prevention Program, Healthy Food Integration Program. It is a research study that involves giving healthy food options to people who are underprivileged, to study whether having healthy food available makes a difference on their outcomes for preventing diabetes. We have 4 different groups of the diabetes prevention program underway right now, and one of our groups is off-site at the Eatonville location. Those patients have been so engaged that they have already lost collectively over 100 pounds just in 10 weeks. So this program really works if you work it. I also have done some food demonstrations. I do a lot of nutrition counseling, even with children who may be either overweight or underweight. So I'm very honored to have several different a variety of educational and counseling services available here. We also have a support group that meets for our obesity intervention program. It meets the second Wednesday of every month from 5:30 to 6:30. The patients that have been coming to that group have been the most successful in maintaining their weight loss. So I'm very happy to have any assistance and love to work with other people. Thank you.
My name is Liza. I'm the front desk manager. We are usually the first people that patients see when they come to Grace Medical Home. When they arrive to Grace Medical Home, sometimes they're nervous, they don't know what to expect. They may be from a different country, so the language might be a barrier. So we always try to make them feel comfortable. We smile and we welcome them. I want to mention some of the stuff that we do at the front desk. We schedule appointments, we confirm appointments, we check in and check out patients, we answer phones. Sometimes we help other departments if they're in need of our help when we have downtime. We have 2 different shifts. One, it's in the morning from 8:30 to 12:30, and we have an afternoon shift from 12:30 to 4:30. We're usually here Monday through Friday. We close early on Fridays. We close at noon, but we're here till 6 o'clock from Monday through Thursday. So those are the 2 different options we have at the front desk. I also want to talk a little bit about HIPAA. HIPAA stands for Health Insurance Portability and Accountability. We want to make sure that we do follow HIPAA rules. as we want to make sure that we're not fined, and we also protect our patients' information as we would want our information to be protected. Once you're here and you're working at the front desk, we will go over the HIPAA rules and what to expect. So I just wanted to give you a little overview of everything that happens at the front desk, but we want you to enjoy your time here, and we want you to help us be the hands and the feet of Jesus. So welcome to Grace.
Hello, I'm Lynn Ivanek. I'm the Director of Philanthropy with Grace.
I'm Logan Branish. I'm the Development Manager.
And we are the development team. So it's our job to raise funds for Grace to make sure that we are able to keep our doors open and do what we do. We do not receive federal funding, so most of our donations come from the community, individuals mainly, corporations, grants, organizations, and family foundations, things like that. So we're really grateful to all that support us. We ask that everyone gives to Grace, all of our board members, all of our staff. And we do this through mailers, we do this through one-on-one meetings, we do this through presentations and tours. We'd love to tell people about Grace. We really don't do much. We do the tours and we let God do the rest. So we just talk about what we do and who we are. And then if somebody wants to give, they give. If they don't want to give, at least they know about us and they tell other people about us and how we operate here. So it's a joy to raise money for Grace. It's not hard, it's a lot of fun. And we hope that everybody gets involved in that way.
And we also do raise some funds through 2 events annually. One is through our annual Let's Say Grace event, and it started in our parking lot, and we've had to grow it over the years, but it is sort of the Ungala Gala event. So you can purchase a table for 10, no, it's really 10, and you bring your own food, you decorate your table, you dress up, it's crazy, it's like a Halloween costume party. It's every fall in November. We try to keep it around the 2nd week of November. So if you're interested in purchasing a table, please do. We get to share our mission, patient testimonials, our founders, and different people from the community come and speak, and it's always a great time.
Good job, Logan. Anyway, if you want to give to Grace, just see one of us.
Thank you.
Thanks.
I can't hear anything. Oh, thank you again for your time and for watching this video. We hope you learn more about what a Christ-centered medical home for the uninsured looks like. Welcome to the Grace Medical Home team. Now let's get started.